At Advent Health, their experienced and compassionate medical team provides a full range of obstetrics and gynecology services to prioritize your emotional and physical well-being. So joining me now is certified nurse midwife Barbara Vandersall Slocum. Welcome to the show.
Thank you.
Yes. Now, as a certified midwife, nurse midwife, what kind of differentiates you from other OBGYN practices?
Sure. So our practice is relatively new to Castle Rock, even though we've all been, I've been delivering there for over 10 years. But we are a midwifery-based practice. We do have a physician with our office as well. But what we are doing is we're focusing, it's obviously women-centered care, annual exams, pregnancy, birth control, STD screening, hormone replacement therapy. I think that is probably all of the rage these days as well. Longer patient appointments, a lot of education. We want our patients to know that they have been heard, that when they leave an appointment, they don't have questions, that we've answered all of their questions. They feel like it's a safe, comfortable place to be. We're just trying to take care of the whole woman.
Yeah, well, and why do you guys really focus on so many of these other services just outside of the obstetrics in order to kind of have that whole person health care?
So all of the midwives in the practice, we also are nurse practitioners. Okay. So we've got a really broad range of education, a large scope, and we like to practice to that full scope. But that does allow women to continue care with us from adolescence, you know, moms calling and saying, like, my daughter's having terrible periods, can you help with this? To moms having their babies, to bringing in their mother or an older woman coming in saying, I'm experiencing perimenopause, menopause, or complications thereafter. So it allows us to see women and be with them through this whole range in their lifetime, which we absolutely love.
Awesome. Well, and you mentioned adolescent girls. At kind of what age should they be seeking out a provider in women's health?
Sure. So the whole idea of when do women need to have certain specific exams done was changed to about 21 a few years ago. However, I always say it is case dependent.
Okay.
Often we have patients referred to us from pediatrician offices saying, like, we've tried this isn't really working. Are you okay to come see this patient and maybe try and help manage some of these problems or concerns? And of course we are. So what we say is, you know, if you feel like you've kind of reached a dead end with a pediatrician, or you feel like you would like someone more specialized care, this is what we do day in and day out. We'd be more than happy to see your child, bring him in.
Okay, wonderful. And, you know, with the internet, there can be a lot of benefits because you can gain access to information. There can also be a lot of misinformation and miseducation. What should women know? Are there certain things that they should be aware of? And really kind of how often should they be visiting a medical provider for their women's health? Sure.
So a number of years ago, too, it came out the frequency for PAPs changed, and it was, you know, every year, now every 3 years or every 5 years, or maybe you don't ever need them anymore. And how a lot of people have interpreted that, either individuals or other healthcare professionals, like, we don't ever need to look at that area again. And that is not true. Okay. Just because you don't need cells swabbed from a certain area does not mean we should not still be looking at that skin, at that tissue. So we still recommend coming in annually just to get an evaluation. We want to make sure that you are living your full, best, healthiest life. Plus, also it gives us a chance to address other questions or concerns. Are you still comfortable in this area? Are you having pain, issues, things like that? Genital urinary problems, pain with intercourse, just a lack of libido. It gives us a great opportunity to initiate that conversation and discussion, and then how can we help you and make this better?
Wonderful. Can you go into some more detail about your Castle Rock location and really kind of the personalization that you guys are offering with the services that you have?
Absolutely. So like I said, I've been delivering at Castle Rock Hospital for at least 10 years. It is a destination hospital. I've had patients who've come Evergreen, Pueblo. We had a patient actually a number of years ago who had moved to Utah. She loved her experiences. We were able to give her a service that wasn't offered in her area. So she actually came back for us to deliver subsequent babies with us. The hospital is beautiful. It's new. We have a birth concierge. So one-on-one, you go in, you do your birth wishes, you get the tour. They send moms home with a meal after they deliver. So it's one less thing you have to worry about going home. You're already stressed and maybe feeling a little overwhelmed. But we take such good care of the moms. The hospital recognizes all of the things that we want to do to help individualize your care, so make people feel heard.
Well, great. Thank you for bringing this to our viewers today.
Absolutely.
And for whatever your medical needs entail, contact Advent Health for collaborative care to help you live whole. You can visit adventhealth.com to find comprehensive midwifery and OBGYN care. Just give their office in Castle Rock a call at 720-330-1460 to schedule an appointment today. They paid for this segment.